CBS 21 News begins with breaking news.
It is breaking news surrounding Senator John Fetterman, the Democrat checking himself into the hospital. Second time he's been hospitalized in the last 7 days. Thanks for being here with us at 6 o'clock. A lot to get to on this topic. According to a statement from his communications team, Senator Fetterman checked himself into Walter Reed Medical Center for clinical depression. They say the senator has experienced depression on and off throughout his life, but it's become severe in recent weeks. So he's receiving treatment now on a voluntary basis. His doctors saying, quote, Fetterman will soon be back to himself. His wife, Giselle, tweeting this: there's probably no one who wanted to talk about his own health less than John. I'm so proud of him for asking for help and getting the care he needs. She goes on to say, take care of yourselves, hold your loved ones close. You are not alone. The senator checking himself in is something many people can relate to. Senator Bob Casey tweeting he's proud of his Democratic colleague, saying we're taking a close look now on what this means to be diagnosed with clinical depression. So we got an expert here with us. I'm joined by Tom Longnecker, a therapist and clinical supervisor with Retreat Behavioral Health. So let's make this clear. The senator, not your patient, but we want to get a feel for what this could mean. Clinical depression, let's start with that. What is that term?
Clinical depression is just one of the flavors or degrees of depression. It tends to be potential to be more incapacitating in life than other kinds of depression, such as dysthymia. It tends to be related to fatigue, difficulties with sleep, whether that's any form of sleep, usually that has no relief, and also some degree often of despair and a real kind of siphoning or chewing away at one's imagination to be able to see outside of the situation that they're in.
Yeah, what kind of relief can you get then when you check yourself in and see an expert?
Okay, well, there's depression is treated generally in a combination of both psychotropic medication, because so much of this is an issue of simply neurology and needing to reformat and help the brain function better, as well as doing psychotherapy. And really, in a lot of ways, the medical route is something that allows people to have the energy and the capacity to do the work of therapy.
What about some symptoms? When you're having a bad time to when you're really experiencing depression to a point where you need some help, what are some things people can look for in themselves or maybe someone that they love?
Certainly, there's a huge distinction between being sad and being depressed. Sadness is often a very full emotional response that is very painful, but it's a very emotional, it's very, very full, whereas depression is often characterized by a real numbness, a difficulty functioning. As I said before, I sleep too much, I don't sleep enough. Either way, I'm not refreshed. I don't go into my day well. It can be correlated also with just kind of brain fog. It's difficult to really think through problems that otherwise would be quite simple to figure out. And then again, another piece is often despair, with sometimes thoughts of self-harm or suicide.
What's harder, you think, or maybe they're the same? Accepting this is where you are and then getting yourself some help, or actually the help itself and the treatment? Can you take us through those two real quick?
Certainly. I think it's, I doubt that I doubt that Senator Fetterman is really a minority in terms of people with this in his age frame, as well as stressors in life, to experience major depressive disorder. He is a minority in terms of people in the public eye like that to be willing to go public and talk about this and advocating for his own self-care. That is often a huge barrier to overcome. I can just speak anecdotally from my own work with people that we care for here, that oftentimes they're saying, I wish I had done this sooner.
Right. Makes sense. Hey, thanks so much for your insight on this. Tom Longnecker helping us out today. We'll see you.
Thank you so much for having me.
Yep.